Welcome back to Studio 10. Now, any personal trainer worth their salt will truthfully tell a client you cannot spot train. It's a proven fact.
And it's a fact that can be terribly frustrating, especially for folks who've lost a lot of weight, but you just can't seem to get rid of those particular pockets of fat here and there.
But there is an answer, and here to explain what it is and how it works is board-certified plastic surgeon Dr. Noel Tenenbaum. Welcome back to Studio 10, Dr. Tenenbaum.
Good morning. How are you today?
Good.
We're talking about Smartlipo Triplex. What is that exactly?
Well, Smartlipo has been around for a few years, which is office-based laser-assisted liposuction. The Smartlipo Triplex stands for 3 different wavelengths in the laser machine. I'm the only physician in Pinellas County that has this machine, and by adding this 3rd wavelength, which is a so-called 1440 nanometer wavelength, it allows you to melt the fat cells very, very rapidly, 40 times quicker than the older Smartlipo machines.
So laser is pretty commonplace, but what you have is, no pun intended, is cutting edge.
Correct.
And there's a tightening that happens because of that as well, right?
Right. There's 2 different settings that I use on the laser. The first is, again, this is being done in the office under local anesthesia. Once the anesthetic is in, we turn the laser on and we melt the fat cells down. That takes about 15-20 minutes for whatever spot of the body I'm working on. And then we readjust the laser to heat the skin and stimulate the skin to shrink and tighten. So you get two effects of the laser for the price of one.
Talk to us about your particular training and how that differs from, say, a traditional physician or an OB/GYN or something.
Sure. I'm a board-certified plastic surgeon, so I actually was board-certified in general surgery before doing plastic surgery residency as well.
Now, let me interrupt you for just a second. We hear that term a lot, board-certified. What do you have to do? Do you have to do surgery in front of a bunch of people and they grade you? What is that exactly?
It's not American Idol.
Well,
Jennifer Lopez would be welcome to come on. In any event, what we do is we do 7 years of residency training to become a board-certified plastic surgeon. You have to sit through plastic surgery boards, which are both written and oral, and you have to submit your case log to be reviewed by the American Board of Plastic Surgery. And once that's occurred over 7 or 8 years, you've sort of fit all the criteria to be trained to do these procedures in the state of Florida.
It's like earning your stripes.
Correct.
Okay.
Correct. Now, what's happened is because some of these smaller machines can be purchased on the open market and so on, some of the med spas have physicians that have taken a 1 or 2 hour weekend course to train in procedures like liposuction and so on, and then they advertise themselves as cosmetic specialists. And so I try to point out to the public and to patients when they come in that if they can verify that the person is board certified by the American Board of Plastic Surgery by calling, and they can also check the local hospitals. Anybody performing a plastic surgery or liposuction in an office setting should also have privileges at local hospitals or ambulatory centers.
Now, we were mentioning that this particular procedure is great for folks who have specific areas that they want to tone down, if you will. Who's a really good candidate for Smartlipo Triplex?
Anybody that is in a reasonable, close to ideal body weight that has a spot, like you mentioned before, whether it be a patch on the side of their hips or on their abdomen and so on. Any place where there's a spot to be reduced is a perfect candidate. The problem with our American society at this point is a lot of people are overweight and they're looking for Smartlipo or Smartlipo Triplex to reduce their body weight. It's not really a body weight loss treatment, it's really a body contouring treatment.
And you're taking a look at some of the examples now, and we've seen arms, we've seen hips, we've seen stomachs. This is an amazing transformation, I think, right here. But you can really target specific areas very carefully now because you have the laser technology, right?
Right, and the laser causes less trauma. The patients are up and around the same day. They leave the office 5 minutes after the procedure's done, and they can be back at work the next day.
What kinds of things do you need to keep in mind, not necessarily 2 or 3 weeks after surgery, but let's say a year or 2 later, in order to maintain the look?
Once you get down to the contour that you desire, really it gets back to, appropriate eating, not necessarily dieting, appropriate eating and exercise. You have to, what you take in has to be equated with some type of work effort to put out. And really, once you've smoothed out those bumps or contours and so on, and the skin is tightened a little bit, you really can turn back the clock 5 or 10 years.
Well, and ladies, I think we're all thinking about looking our best because this is the month of love, if you will. well, and you are doing a very special offer for folks out there who want to target specific sites during the month of February. Now, is this booking in February or coming to see you in February?
Anybody that schedules a procedure during the month of February will be eligible for the promotion that we're doing.
And that is $999 per site. So that's sort of like arm, side, stomach, something like that, right?
In the arms, $999. The upper abdomen, $999. Lower abdomen, $999. Inner thighs, same thing.
So there you go. And there is the information that you need. You can call Dr. Tenenbaum at his office, 727-786-6921. You can also log on to drnoeltenenbaum.com or go to studio10.tv because we have all the information for you there as well.
Smartlipo Triplex. Ask for it by name. Triplex.
Thanks, doctor.
Thank you very much for having me.
All right, up next, a live performance from the show Les Miserables. Stay tuned. We'll be right back.
This segment was sponsored by Noel Tenenbaum Plastic and Reconstructive Surgery.